Have you ever noticed a little one tugging at their ear and wondered what is going on? The ages most likely to pull ears are typically infants and toddlers, specifically those between 6 months and 2 years old. This age range is particularly prone to ear pulling because their bodies are still developing in several important ways. One key reason involves the eustachian tubes, which are tiny passages connecting the middle ear to the back of the throat. In young children, these tubes are smaller, more horizontal, and not yet fully developed. This makes them much more likely to become blocked, trapping fluid behind the eardrum. When fluid gets trapped, it creates a perfect environment for bacteria or viruses to grow, leading to an ear infection, also known as otitis media. This is why ear infections are so common during these formative years. Another factor is that their immune systems are still maturing, making them more susceptible to colds and other upper respiratory infections. These infections often precede ear issues, causing swelling that further blocks those small eustachian tubes. Furthermore, babies and toddlers at this age often explore their bodies, teeth, or might even just be tired, which can also lead to ear touching or pulling without an underlying infection. It is a cluster of developmental factors that makes this age group so likely to touch and pull at their ears. So, if you see your little one pulling at an ear, it is important to observe 4 other symptoms. Look for signs like a fever, increased fussiness, difficulty sleeping, reduced appetite, or any drainage from the ear. These additional clues can help you determine if a visit to the doctor is warranted. While ear pulling alone can often be innocent, when combined with these other indicators, it strongly suggests otitis media, the medical term for a middle ear infection. The peak incidence for these infections is typically between 6 and 18 months of age. Understanding this helps you differentiate a casual ear tug from a potential health concern. Remember, not every ear pull means an infection, but it is always a good idea to be observant during these critical developmental stages. By understanding why infants and toddlers are most prone to ear pulling and knowing what other symptoms to watch for, you can confidently monitor your child's health. This knowledge empowers you to make informed decisions about when to seek professional advice, ensuring your little one gets the care they need for their comfort and well-being.